All right, I am officially live on Instagram up here and Facebook down here, so we'll see how this goes. So this is part 2 of the Foundational Wellness series, and I'm realizing the lighting on the Instagram is not very good. Oh well. So part 2 of the Foundational Wellness series. So today I'm going to be talking all about movement as medicine. So before I get started, I've created a whole resource for you guys. It's a movement is medicine guide. So it has free workout links. It has more websites that I have created all about like details of resistance training and aerobic exercise. It has all the details that I'm going to be talking about today, any signs and symptoms you need to pay attention to of major disease, benefits of exercise, any risks that are associated, the guidelines for exercise. I'm going to be talking about aerobic activities, resistance training. I'm going to kind of go through these somewhat quickly because the guide is super thorough, but this video is just going to kind of be an intro to it. And then I have tips on sticking with the exercise because I know we all, fall out of the habit of our movement. So I have some tips for you there. I have some tips on nutrition and some resources for you as well. And then I have also listed natural tools to support your fitness for pain support, energy management, respiratory, sleep, immune system. It's super thorough. So you're going to want to go download the guide after this video if you want to. It's the link in my bio on Instagram has it, and then in Facebook I just included it in this description of the video. So it's link in my bio, or it's bit.ly/Aaliyah movement. So you can access it for there. So that's kind of overview of what I'm going to be covering in this video, and then also what's in the handout. So basically I want to first go over any signs and symptoms that you need to be aware of major cardiovascular, metabolic, or renal disease, because this is really important to actually get medical clearance before you start exercise. So pain in the chest, neck, jaw, and arms, unusual or shortness of breath at rest or mild exertion, swollen ankles, burning or pain in your leg, feeling of like breathlessness when lying down, any kind of known heart murmur that you have, feeling your heart is really racing or skipping beats, and then dizziness or loss of consciousness. So if you have any of these signs or symptoms, you want to go talk to your doctor before you start exercise. That's really important. And let me back up here. So last December of 2019, I graduated with a Bachelor's of Science in Kinesiology. And I also got my personal trainer certification through ACSM, or American College of Sports Medicine. So I have some education behind this. I'm not just spewing random information. So benefits of exercise, oh my gosh, the list can go on and on and on. I'm not going to read all of them, but it really supports a holistic wellness. It really supports holistic wellness in our body in many different ways. If doctors could prescribe exercise in a pill, that would be the most prescribed pill or prescription there would be. It helps decrease premature mortality. It helps decrease cardiovascular disease, cancer, type 2 diabetes, stroke, osteoporosis, hypertension, weight control, bone, joint, and muscle health, mental health, obesity, and it decreases the amount of falls, especially for the elderly population. So those are just some of the benefits. And then specifically for the immune system, it really helps move our lymph and our lymphatic system. So this is really important because our lymphatic system is really an integral part of our immune system. So exercise or any kind of movement helps the muscles contract and relax, which then pumps the lymph fluid through the lymphatic vessels. So I did another video on lymphatic support, so you can access that on my Instagram as well. And then also sweating is really supportive for our immune system because it helps filter toxins out of the body. And then we're going to go into, are there risks of exercise? Well, there are, but all benefits outweigh the risks. This is really important to not let that hinder you from actually starting to exercise. So, and I'm going to be going over some tips about really how to start small and how to make it feel doable for you. So, and what's cool about the risks is all the risks decrease as you increase in exercise. But again, it's really important to start slow. So you might be wondering, like, okay, that's all great and all, but like, what's my target goal of exercise? Like, what are the guidelines of how much I should exercise? So the main thing is to move more and sit less. That's really the general bottom line. So whatever feels best to you to get started. I know I have fallen in and out of different exercise routines many times. And I'm going to be going over again at the end how to actually adhere or stick to the exercise routine or movement routine. So if you just want to start slow and just say, I'm going to move my body like 3 times a week, that is awesome. If you don't remember anything else from this video, just remember to move more and sit less, and you're going to be on your way to a healthier you. Any amount of physical activity has some health benefits that are immediate. But again, it's really important to start slow. And then choose a goal that feels light to you, that brings lightness to you. I know, especially right now with the coronavirus, things feel really overwhelming, and it is extremely important to actually rest and let ourselves relax. But if you feel inspired to start moving, start with a goal that feels good to you. So basically, for adults, the minimum requirement, if you're just starting out, is your goal is like 60 to 150 minutes of light to moderate exercise per week. If you have minimal activity that you're already doing, the goal is 150 to 200 minutes of moderate activity a week, or 75 minutes of vigorous activity. Now I'm going to be going over what those actually mean here soon, or a combo of both. So basically anywhere from 60 to 150 minutes of moderate activity, or 75 minutes of vigorous is your goal. And then resistance training, I'm going to be going over as well. And then there's some different requirements for kids and older adults, but that's all detailed in my handout that I've created. All right, so some different aerobic activity ideas. So aerobic exercise is basically any type of cardiovascular training that increases your rate of breathing. So that's kind of a really simple definition. I have some definitions of like what low intensity feels like, moderate intensity, and vigorous. But I mean, walking counts, hiking counts, especially right now with the whole coronavirus thing going on. It's really important for us to get outside if we can. Now, I know that a lot of places have closed down the hiking trails, so do what you can, but if you can, try to get outside at least once a week, or just walk around your neighborhood, whatever your area is allowing you to do right now. Dancing counts, right? You can look up some dance YouTube videos. Running, of course, counts. Swimming, if you want to jump in the ocean or river, I'm not sure where you live. Any kind of like gardening or kind of heavy farming counts as well. So maybe you want to start a vegetable garden. That's a really good time to do so. And kind of getting that more housework counts as your aerobic activity. So, and then also if you're short on time, if you just have 10 to 15 minutes, do a high intensity interval training. You'll see this abbreviated as HIIT. And so that's basically when you work really hard for anywhere from 20 to 30 seconds, and then you rest for about 20 to 30 seconds. And so there's tons of videos that you can find on YouTube, but having a short amount of time does not mean you don't have to, that you can't exercise, because that high intensity interval training is actually really, really effective, because you're able to work at a higher intensity for a longer period of time than you would if you're just going straight through with no rest. And then resistance training. So I think a lot of stress has been put on aerobic exercise, but maybe not enough stress on resistance training. Resistance training is extremely important. So it's basically moving the body against any sort of resistance. So resistance could mean your body weight, bands, free weight, kettlebells, medicine balls, water jugs, laundry detergent jugs, kids. If you have a baby, that totally counts. You know, include your kids in these sort of things as well. So that all counts as resistance. So start with what you have. I just have some kind of light weights. I have like 4 pound, 8 and 10 pound that I've just had. So I like to utilize those, but you don't have to have anything if you don't want to. There's tons of exercises that you can do just with your body weight. And so the goal of resistance training is to work on a weekly basis, work each major muscle group twice per week. That's all we have to do to experience significant benefits of this. So resistance training is going to support our bones and joints and muscles, and it's going to help our aerobic training as well. It's going to help protect us from injury. So there's lots of benefits of resistance training. And again, if you're more of a visual person, this guide has lots of links to external resources. So go check out the guide. So basically, a resistance training workout, it should be max 45 minutes, because the exercises that I'm going to list, they're called core exercises. So they work multiple joints. So, for example, a squat is called a core exercise, not like core as in just like our midsection, but core as in it works multiple joints. So, example, a squat, it's going to bend. Let me back up here. Facebook is not as good. A squat bends our knees and our hips. So that's how you know it's a core exercise. So that's really important because those are the most basically effective exercises, and they're the most efficient as well. And so a 45-minute workout consists of a 5 to 10 minute warm-up. This is actually really important to kind of get the blood flowing, get the muscles warmed up. And then basically 5 to 6 exercises of whatever you choose. I'm going to go over some examples. It's good to start with like 3 sets of 10 to 15 reps. And so again, if you're like, what are reps and sets? Go check out the guide. It has some details of that. And then afterwards, 10 minutes of stretching. So in 45 minutes, you can get done a full body workout. It's really efficient. So some examples. Ideally, you want to be picking like 2 exercises for the lower body and 2 exercises for the upper body, and then like a core exercise. So that's where the 5 exercises come from. Now for the upper body and lower body, you want to choose a push exercise and a pull exercise. So we're really making sure all major muscle groups are being worked out or exercised, for lack of better terms. And so I have a whole table here of examples of push-pull exercises for upper and lower body. So for example, upper body, a push exercise is shoulder press. Boom. See how it's kind of like pushing away from the body. Now an upper body pull exercise, again, it's a little awkward with Facebook and Instagram because it's different video. Pull exercise is like a bent over row, so you're kind of pulling towards the body. You really want to make sure your back is flat and you're pulling here. Now for more details of like specific form, I would look on YouTube. This is not meant to be like a totally comprehensive, oh, that's a nice boob shot there, totally comprehensive video of like exactly how to do each exercise. And then let's see here, for upper body, tricep dips are another really good one that you can do like anywhere. And then a really cool tip that I've been trying to incorporate is like while I'm doing my aerobic exercise, whether it's just like a hike or a walk around the neighborhood, I like to incorporate some of these more resistance training. So I'll do like a set of lunges, and then I'll take a break and keep walking, and then I'll do some squats. And then I'll find like a tree branch and do some tricep dips or push-up. So you're kind of incorporating the resistance training in with the aerobics. So that's kind of a tip to save time as well. Lower body examples. Of course, let's see, for the upper body, Push-ups are also a push exercise, obviously. So some ideas, if push-ups are too hard for you on the ground, like I know I've had a lot of wrist issues, and so I've had to modify that as a lot. So you can start against a wall. So start against like pretty straight up and down. You're just pushing against the wall. That's going to reduce the resistance. And then you can move to, maybe you move your feet a little bit farther away from the wall and you do your push-ups. And then you can move to an incline push-up. I don't know if this is going to work. This can be a nice butt shot. But you're doing it against something where your body's inclined. So you can do it up against a counter or whatever. So there's lots of variations here. And then once you get good, you can do decline push-ups. You can do like single arm push-ups, whatever you guys want to try out. For lower body, squats, of course, are really good. You can do them with or without weights. Lunges, squat jumps, step-ups. This is another thing I like to incorporate when I'm like hiking or whatnot. Just find something you can do step-ups on. It kind of increases the resistance there. And then glute bridges is another good idea for lower body. And then for pull exercises, these can be a little more challenging if you don't have some sort of weight. But an example of a pull exercise for the upper body, which I already mentioned, is a bent over row. Or if you don't have the strength to do a bent over row, you can, how do I show this? You can kind of like do one arm at a time, so you can lean and just focus on one arm. But it's really good to actually move and to have a goal of to do the bent over row because it really engages the core. You can do deadlifts, but deadlifts can be challenging without a bar and the right weights and gear. So RDLs or Romanian deadlifts are really good. So basically just getting any sort of weight. Again, I have free weights, but you can use whatever you have. A laundry detergent jug works really well. And that's basically where you're just, feet hip distance apart, kind of engage your core, have a slight bend in your knees, and then Facebook, I'm sorry, you're getting a really bad angle of this. And you're just gonna bend over and really use your glutes and hammies to bring yourself back up again. So that's a really good pull exercise for the lower body. So that's kind of the basics of resistance training. I would definitely encourage you guys or invite you guys to start incorporating some of that. I'm still working on getting it more consistent myself too. And then next I'm going to go over just some like general guidelines and tips for actually sticking with an exercise program, because I know it can be really challenging to first of all start an exercise program. I know it can feel really overwhelming. If you're overwhelmed, try to just start with like 10 squats when you're brushing your teeth or something, or 10 squats right now. Like if you're feeling really overwhelmed and a lot of resistance to start movement, stand up and just do like 10 squats right now and you'll feel so much better. I swear, I do this all the time. So some tips for sticking with your exercise: find your why. Really brainstorm why you want to exercise and why it's important to you. And then also, second tip is to plan. Like write specific workouts in your calendar so you know exactly what you're doing on a specific day. And start slow. I've mentioned that over and over again, but start with 10 minutes a day if you're feeling overwhelmed. That's really doable. Goal setting, keep your goals small and doable. Keep progression small and sustainable. Find some sort of social support, whether it's finding a workout buddy or a workout class online that you enjoy that's consistent. I've linked some free workouts in this guide as well, so you can check that out. Mix up your type of training to keep interest, and then I have some other ideas here that you can check out in the guide, but I want to make sure we wrap up in the 20-minute mark. Next, I'm going to just mention briefly about nutrition. Nutrition is foundational for exercise because it's the fuel to actually allow our energy systems in our body to function. A note here, carbs are not the enemy. Carbs are actually really needed for those energy systems that I just mentioned. Now, the type of carb matters. If you're eating a lot of processed breads and grains, that's when things get a little shady with the carbs. But if you're eating like red potatoes, sweet potatoes, quinoa, brown rice, those kind of whole grains or seeds, those are really healthy and really supportive for a workout regime. And then just to make sure you're well fed before you exercise. That's really important. And then I have a lot more tips for nutrition, but I really find that I do a lot better when I'm supplementing, because it's hard to stay consistent with a really nutrient-dense diet. And so I take doTERRA's Lifelong Vitality Pack. This is just my foundation for my nutrition. And so it really makes sure I'm covering the bases. If you have any questions about this, let me know. If you want to get your hands on some, let me know, or you can check the link in my bio. And then last but not least, I'm just going to breeze through some natural tools to support fitness. I also have a whole fitness and essential oils ebook that you can download that's linked in the guide that I've created. So some different ideas. If you're like, this is all great, Aaliyah, but my knee really hurts when I exercise. So some ideas. First of all, foundational nutrition, making sure you're incorporating some of the things that I have in the guide there. The Lifelong Vitality Pack is really good for decreasing inflammation, which causes excess pain. Also, you can use your essential oils before you work out. That's a really easy way to calm the tissue and to kind of help prevent that pain during the workout. So if your knee hurts before you go hiking or do the exercise, put it on beforehand and after. Some other ideas are Aroma Touch. You can use copaiba, lemongrass, and marjoram. So that all those are really good for decreasing inflammation and reducing pain levels. Energy support, because I know energy is a big one. If you're feeling super tired and run down, the motivation to exercise is just not there. So some ideas for energy. Again, that foundational nutrition is really key. And then another idea is you can take doTERRA's Mito2 Max, which is basically like a natural energy support. So it really supports the mitochondria of the cells, which make the ATP or energy. Some other ideas is you take Breathe, any kind of mint or citrus, put a drop in your hands. This is also going to support your respiratory system. Rub your hands together and take a hit, meaning cup your hands together and breathe in through your mouth. And that you just kind of immediately feel invigorated. You can rub any kind of excess on your neck and chest, and then you're going to start your workout. So that's really going to kind of invigorate you, open up your airways, especially if you have any specific respiratory challenges that you're dealing with. That is an incredible tip that I think all of us can use. Peppermint, of course, is good for that. Eucalyptus, any kind of fir oils are great. You can also, another tip for energy is to add citrus essential oils or Slim and Sassy to your water. So that way you're able to smell the citrus oils and drink it. It's really refreshing. That one's tangerine. It's delicious. And then muscle support oils. Again, if you're feeling really sore, you can, after your workout, you can do a massage for yourself with any of those oils that I mentioned earlier, Deep Blue, Aroma Touch, with some coconut oil. It's really helpful for sore muscles and for tissue repair. You can also do a bath, like a Epsom salt bath. That's really good for relaxing muscles. Immune support. I have a whole guide on immune support. I just did a whole webinar. If you want the recording and the handout, let me know. And then sleep support, because if we're not sleeping right, then we are not going to be motivated to exercise. So some tips for sleeping: trying to go to bed at the same time each night, getting off the devices like 60 to 90 minutes before, dimming the lights, using your relaxing essential oils in your diffuser on the bottoms of your feet, maybe making a relaxing, hey Sammy, nice earrings, girl, I wear these all the time. I got distracted. Maybe making yourself a relaxing sleepy time tea with like lavender or petitgrain. And then last but not least, if you're wanting to support like fighting germs, which of course now we're not in like gym settings anymore, but using your On Guard hand mist is a great way, or like a yoga mat spray is just water and melaleuca, lavender, and On Guard or lemon. So you can really experiment with making your own cleaners too. So that was 25 minutes of pretty solid, like at you information. But again, the guide that I've created has all of this information and resources to other education. If you like more videos, everything is linked within the guide. So again, you can get that on Instagram and my link in my bio. Facebook, it's actually already copied and pasted in the description of the video. So let me know if you have any questions. Let me know if you have any additional tips, and I can share those somehow with you guys as well. I think it's really important that we learn from each other. So that's my overview of Movement is Medicine. And remember to download the guide, and it's totally free. And share with me what you're excited to incorporate from this video. All right, my friends, have a beautiful rest of your day.